Hello guys, how are you doing? Welcome to Heto. My name is Kayode Matthew and I'm a lab technician, experienced one. I've been working with different, so you understand. So I am here today to talk about a topic that is very important and that is very important to you guys. It's very important in marriage. So and which is infertility. So firstly, what's it infertility? Infertility is a medical condition where couples are not able to conceive a child after years of regular sex. And it can be a complex emotion issue that affects both men and women. It's not for only women. Sure, understand? Because in some cases, the men will be like, "Oh, no, I'm not the fourth here. My partner, my wife is the fourth here." Sure, understand? Because you ladies are the one that carry these babies, so they feel like once they fertilize you, you must conceive. Sure, understand? So and we have different type of infertility. There is primary infertility and there is secondary infertility. The primary infertility is a condition whereby the couples have never conceived. They did not have a child at all. So this secondary infertility is when the couple has previously conceived a child, but now is not unable to conceive again. That one is even more better than the first one, because if you have one or two children and you want again, you are unable to, you can still like, okay, I'm grateful that God has, you understand? So what we and this infertility that we are talking about, it always damage marriage. It damages marriage a lot, and that is the reason why I show on your screen today to put you guys through what you guys need to do to overcome this. So there are some causes that can lead to, there are some things that cause infertility, and I want you guys to know that infertility is not a sickness. It's just a normal stuff that can occur due to some complications we have done some years back. So let's go first with the female factors, causes of infertilities. Number one, we have ovulation disorder. The ovulation disorder is a condition whereby maybe the lady is not ovulating at all. We have blocked fallopian tubes. The fallopian tube is just like a space where the follicles pass through to the uterus. So once the fallopian tube is blocked, it will be very difficult for a lady to conceive. And what causes the fallopian tube blockage, whatever? The fallopian tube blockage can occur when you have too much infections, and the infections might be pelvic inflammatory disease, which is PID. When the infections develop from the vagina, then move to the uterus, and maybe you did not notice that something is wrong with you and you keep having sex, or you keep having sex, and the thing will keep growing, and once you grow from your uterus and then spread to some parts in your uterus, like move to the fallopian tube, it can cause blockage in fallopian tube and then affect your ovaries. So as a ladies, you have to always run tests once in a while to check what is wrong with you. So you understand, for you to overcome all these kind of issues. And we have endometriosis also, and we have polycystic ovaries syndrome. This polycystic ovary syndrome it occurs in the ovaries when the follicles is affected by cyst. You understand? And that too can occur when infection is too much in your body. So and these infertilities at times can occur when it sticks to, let me put it like that, age related. There are some age whereby you won't have quality eggs as a woman to conceive. a baby. Do you know that when you are still at age of 20, 22, 30, your the way you perform, the way you act is different from that of when you are closing to 40, 50. Do you understand? So, and for the male factors, we have low sperm count. Low sperm count can cause infertilities in men, or poor sperm motility. When your dead ones is much than your active ones, maybe your sperm is watering, all that kind of stuff can cause infertilities in men. And abnormal sperm morphology too can cause it. And there is now one issue that affects both partner, which is hormone imbalance, because both men and women has hormone. Hormone is a chemical substance that send message in our body, like our LH, which is your luteinizing hormone, the FSH, your follicle stimulating hormone. We have the PRL, which is your prolactin, the progesterone for women, and the testosterone for men, and there's estrogen for women also. The progesterone and the estrogen, the progesterone and the estrogen is deals with your reproductive system. Why the testosterone in men also do with your reproductive system? You understand? So, and there is one thing, and there are life factors that can lead to infertility also, like smoking, excess alcohol consumption, obesity, stress, and compulsion to environmental toxins. Masturbation. How masturbation affects both men and women. As a man, if you are masturbating, you are going to have low sperm count, and your sperm quality is going to reduce, and it can lead to weak erection at times, whereby your manhood there will not be any sign of erection in your manhood anymore, because it affects our tissues, and infertility, and this thing called masturbation can lead to infertilities in future for men. It can lead to infertility because once you have low sperm count and you have low sperm quality, maybe you are unable to perform as a man in your marriage, it can lead to infertility. And as for the ladies that masturbate, like they finger themselves, like it affects them, because once your clitoris is out, do you know that when you masturbate to some extent, your clitoris will come out, and there's no any assurance, there's no any medication for that to going back, and it is going to affect you. Masturbation affects in different ways, and it affects couples' life nowadays. So you guys need to be very careful. Keep yourself. If you feel like we are all human beings, so if you feel like you don't need to masturbate, you can. And if you don't have partner, you don't need to masturbate. You can take your Bible, start reading your Bible, do some things that's going to distract you from masturbation. It can lead to infertility also. And there are symptoms for infertility. It's not a sickness, but there are some things you are going to notice. And for you to know what is wrong with you exactly, for you to look at that, this is what is wrong with me, you have to, in some cases you have to go for a test. You can't just, because it's not a sickness. At times you don't show any symptoms. Like now in women that is affected by infertility, can see symptoms like irregular menstruation cycle, difficult conceiving, and painful intercourse. And there is pelvic surgery or infections history. Maybe you have go through D&C or surgery when you have carriage tissue that maybe there is tear or wound in your uterus. It might lead to infertility. The uterus will not be able to implant follicles, and then the follicles will generate to grow to embryo and then fetus, and then you deliver your baby. So when there is complication of all this complication of your surgery, and the D&C can lead to infertility also. And before you can And I have some people that will ask me that does infertility has treatment? Yes, it has treatment. But before you can go for treatment, you have to run your tests and know what is wrong with you exactly. Okay, this is my own case of infertility. There are different cases. Some people, their own might be infection. We talk about, I said something about irregular menstruation cycle. That irregular menstruation cycle can occur in three different ways. Maybe when you have infection, which is PID, or when your hormone is not balanced. As a lady, it can lead to your menstruation cycle might be changing, or might not. Maybe before you menstruate, five when menstruating, you menstruate like for 5 days, it might reduce. Or in some cases, when your hormone is not balanced, it leads to like amenorrhea, climacteric, and menopause. She understand whereby a 27 years old or 30 years old lady is no more menstruating. So everybody have to be careful. And what I mean by our past life stuff that can affect us, that can lead to infertility, is that there are some ladies outside there, maybe when they are still small, they don't want, or they are maybe they have unwanted pregnancy, they will like, I want to terminate it. The drugs that we use always affect, that it takes always affects their progesterone and estrogen. It always affects them. There are some ladies that okay, because they don't want to have pregnant, they will like take postino or abuse some drugs to preserve themselves from pregnancy, and that is really causing, is really affecting them when maybe after getting married, and then they will start facing different problems. So there are tests that you can run to know what is wrong with you exactly when it comes to infertility, like your hormonal assay. Is also hormonal profile. The hormonal assay is going to tell you the range of your the range of hormones in our body, like our LH, like I said earlier, your FSH, your prolactin, progesterone is going to show you. So in men and women, our LH and FSH must not be higher than from 4 to 20. Do you understand? And in some cases whereby maybe your woman progesterone is low and the estrogen is low, it will be very difficult. It can lead to short luteal phase. It will be very difficult for the woman to conceive. So when it comes to medication, after your test, maybe you have run series of tests. The series of tests you can run as a lady to overcome infertility is your there are some tests you can run. Like I said earlier, that your HVS, high vaginal swab. The HVS is for women who your high vaginal swab during MCS, hormonal profile. In some cases, they can ask you to go for your folliculometry, pelvic scan, and in some cases, you have to go for HSG for them to be sure of what is wrong with you exactly, and then they'll be able to treat you. They'll be able to like overcome your own. Your own might be after the result is out, your own might be okay, ovulation disorder or blocked fallopian tube. So and etc like that. So that is why you have to run tests. If you don't run tests, it's just like you are just giving your doctor like if you are just giving your doctor, you just want to put your doctor through stress. So you have to run tests. And as a man, you have to run your sperm analysis, your urethral swab during MCS, and you can, in some cases, they can ask you to do scrotal scan to check your testes, to check maybe there is blood flow, or your testes are okay, that there's no any problem with those two balls down there. So once you guys have go through your test that you're okay, your doctor has go through your test and everything is okay, maybe there's any complication or there's anything they have to treat you on, but you guys are okay, your doctor will be the one to, and even though you guys are okay, there are some tips they are going to give to you guys to follow, and you guys will have happy ending and you'll be like, wow. And now in some cases they'll be like, when you have blockage in fallopian tube, when you have blockage in fallopian tube, they'll be like, you have to go for surgery. And once you operate the fallopian tube, it might be very difficult. So there is a way you can overcome that. It's something I've experienced with my boss because I've worked with a lot of different bosses. So they have herbal remedies to unblock the fallopian blockage. There's herbal remedy for infertility to overcome all these, any kind of issues that might be affecting you. There's herbal remedy for it, because herbal remedy is the best to overcome all these kind of issues. So you don't need to stress yourself. You can, if you want to, like, if you find this topic interesting and it's something that is affecting you, you can come to us so we can put you through, and I will link you up with one doctor that is into herbal remedies for you to have happy ending in your marriage. Like, they have, it's not someone that is doing, maybe doing or applying your, no, they have packs for ovarian cysts. They have herbal remedy packs for fibroid, herbal remedy for cancer, different type of stuff, and the man has handled different kind of elements that are okay. I'm a lab technician, so that's why I'm telling you this. I'm telling you this because I'll be happy if I see you guys having your babies. I'll be happy also. So you understand? You can come. The man name is Dr. Saem. There has different branches in Ikeja, Ijoku, and Ibadan. They have their standard medical lab. So if you want to go for your herbal remedies, you can come to Dr. Saem Clinic to visit the man there. He has some powerful remedies, herbal remedies for you guys to overcome infertility. So guys, just like and share this video. If this video is not what you need, you can share it to your friends and family, so they might need it. So, and my name is Kayode Matthew. I love you guys. Bye.